Great. Thanks so much, Genevieve. Welcome, everyone. I'm Roy Strowd, a neurologist, neuro-oncologist at Wake Forest School of Medicine. And on behalf of the AAN, I'm really excited to kick off tonight's guest neurologist session and welcome you. Great to see everyone here. We have an exciting hour, and I'm really excited to kick this off. This is a new program offered through the American Academy of Neurology targeting college students. And the goal is to provide increased exposure to neurologists and just to get you excited about neurology and the field of neurology and wanting to become a neurologist and talking about what neurologists do and how the brain works. We held our kickoff session last month, and we're sort of doing a tour of the United States and targeting different students with each session. And this session is targeting students currently or recently enrolled at an HBCU. So I'm really excited for this session and to introduce the two, I'll call them speakers, but this is really more of an informal discussion. So, our two kind of fireside chat discussants for the night, and we have a great schedule planned. So here with us and I'll first introduce Dr. Michael Johnson. Dr. Johnson's great. He is currently completing epilepsy and clinical neurophysiology fellowship at Vanderbilt University. So he knows all about how to record the brain and how to watch how the brain works, and can talk a little bit about that. He has practiced as a general neurologist while in active duty in the military, and so also has a unique perspective and background that you may want to ask him about. And an interesting tidbit on Dr. Johnson: he's an avid video gamer. And an anime enthusiast. So for all those video gamers out there, you got to bring your questions about that to him too. And he would love to talk about his journey, and really here to talk about his journey to where he is, how he got there, what he does, what his day in the life of Dr. Johnson is, and would love to answer those questions. With him is Daniel Ragheb, and Daniel's great as well. I'm really excited Daniel's here with us. He is a recent double major in neuroscience and political science. So he's a complete slouch, as you can tell, and doing a lot of good work. He is currently pursuing his MD degree at Vanderbilt as well. And he's still exploring the field of medicine and hopes, he wrote, and I love this, hopes to pursue his love of both the brain and the heart. And those are two organs that overlap heavily. And we're going to steal him to the brain, but the heart's, right there and important as well. He also loves watching and performing improv. So if we get a lull in the conversation, he's going to do some improv for us as well, maybe. And he's here with us as well. And I hope you will ask Daniel some questions about his path to where he is in medical school and what he's interested in. This is going to be an informal discussion. So to start us off, Dr. Johnson and Daniel are going to talk a little bit about their paths to where they are. They're going to give you some ideas of who they are and how they got there. And I want you to be thinking about those questions that you want to ask them about how you get there and how you see yourself doing that. And then we will open it up to your questions. And that's the fun part of this session. So bring your questions. Any question is in bounds. There is no out of bounds question, no matter how big or small. We've also sent you some questions. And so if you just don't know what to ask, start with those. And those are some good questions that students often like to ask. We will use the Q&A feature for your questions. So you can type them in while you're listening to Daniel and Dr. Johnson talk. And then we'll pull you up on your audio, and we'd love to hear you ask your question as we transition to that. So Dr. Johnson, Daniel, I'm going to turn it over to you and let you get us started.
Hey, everyone. I want to quickly echo how much of a treat it is for all of us to have Dr. Johnson here. He's actually a mentor of mine, and I've got to hear a lot of his journey into medicine. And so actually, Dr. Johnson, if it's okay with you, I want to start us off there. And we'll first give you a chance to say anything else that you wanted to say in introduction to yourself, but then also I wanted to start things off with just being like, why medicine? Like from the very beginning, what did you know I want to do medicine in general?
Yeah. So first and foremost, Daniel, thank you for interviewing Dr. Strowd, Lucy, Genevieve. Thank you for organizing this, and especially all the attendees. We're here actually for you, and hopefully some of the information we share will be helpful in guiding your journey as well. And we're here for you as well, not only just now in this session, but in the future. And we'll hopefully share some of our contact information with you after. But Daniel, that's a great question. Why medicine? And I think, growing up, I think I share this with a lot of families, is that, your parents or your family members may tell you, there's kind of two noble professions that you hear about, and one of them is medicine. The other one, is law. But what's interesting is this dichotomy between being a lawyer and doctor, at least within my family, was somewhat limited to actually what my own family members were doing as well. And so they were doing noble professions as well. And that's somewhat lost upon you when you hear kind of, our child wants to be a doctor or a child wants to be a lawyer. But medicine was always touted as this very noble and honorable profession, which it is. But I think also looking back, there's a lot of noble professions actually out there. That being said, it's fully true. On this end of things, growing up and growing into the position, medicine is a very, very honorable profession to be in. And I think, as a broad question, I think that's one of the reasons why we chose this.
Yeah, I'm going to quickly echo what you said, Dr. Johnson. Something I actually saw I don't want to say day one, but month one of school, as we started seeing patients, is how intimate medicine is. People tell you things they don't tell their own families, and it's definitely a very intimate and has to be a loving field. And so I echo that. And to dive a little bit deeper, that's when you decided medicine. At what point did you say the brain is what I really want to focus on?
Oh, I tell folks about this all the time because I get excited about it. And so New York City, third grade, I'm homesick from school. I'm watching TV in bed, and I turn on channel 13 PBS. And so I'm not sure kind of the generational kind of variety that we have as far as all the attendees. But if you recall, Bill Nye the Science Guy, he was a great resource for kind of education and exposure. And this was my first exposure into the field of neurology. Here's the brain. There's so much we don't know about it. But along with that came this potential, right? This is potential for discovery, potential for exploration, potential for all these questions that you have. And so neurology is really and truly fulfilling a field where you could expand curiosity and explore your curiosity into the field. And it's really lived up to that since Bill Nye the Science Guy in third grade.
Still important, actually. I watched him as well.
Okay.
I don't think he's ever going to go. I also, again, narrowing it down again, wanted to ask, as a student through an HBCU, and as you entered, with that passion in medicine and that noble profession, and with that fascination in the brain, what unique aspects of being in an HBCU kind of continued that path or guided that path to where you are today?
Yeah, this is really an important question, Daniel. And I think it's important for our attendees as well, who either they're interested in HBCU or they're currently attending an HBCU, to kind of understand this perspective, and they live it, they experience it. There's several things that I learned at HBCU that I honestly can't say that I would have probably learned anywhere else. And being in an HBCU, I attended Howard University Medical Center, and probably one of the most single important educational experiences in my life, and maybe not one that could ever be repeated in the same fashion again. There's a real emphasis throughout the community at every level on the importance of community and the importance of providing to your community and giving back to your community and elevating your community in everything that you do, that we learn at HBCU. And it was in such a way that it was pervasive throughout pretty much every lecture, every talk, every interaction that we had about how do we give back, how do we engage ourselves into a community, how do we make our community and circumstance better. The other thing that I thought was interesting about HBCU that I think I certainly learned and take with me everywhere I go is that, this sense that you really need to go out and engage and put in effort and sacrifice into what you want. I think it's very easy to have certain expectations that certain things will come to you and, things will be given to you. But you need to go out and achieve those things. And sometimes they don't come easy. Sometimes it takes a lot of work and sacrifice, a lot of effort. And I think my experience in HBCU taught me that. And then the last thing I'll say about HBCU is the first time in my professional educational career that I felt that my opinion was actually being heard and listened to as a Black man. I was often in open conversations with a lot of my colleagues from HBCU, both African-American men and women. And I had never experienced an environment, a situation like that, where there was such a sharing of ideas that was so openly attained in that educational setting. And just the level of professionalism, the level of intellect, the level of kind of cognitive gymnastics that we achieved on that level and being heard, it really did change my perspective and something that's carried, I think, throughout the rest of kind of my career to this point. So there's a lot of lessons, I think, learned at an HBCU that make folks quite invaluable when they have that educational experience there. It's truly prepared me, I believe, for this field of medicine.
And Dr. Strowd, I'm not sure if you're here to say that as well. I see that there are questions in the Q&A. If it's okay with you all, we're going to continue just having this discussion for a little, and then we'll open it up in a few more minutes to the questions that you all have, but please keep them coming. And I want to go back to something that you said, Dr. Johnson, especially on that second point of like going out and sacrificing and fighting for what you want. And this is actually funny, just a few months ago, it is now maybe, I had a little cousin and she's interested in medicine, and she called me just really frustrated, just like, I've emailed now 3 or 4 different professors that I want to do research with them because I know it's important to pre-med, and none of them have even replied. And she was really sad and a little bit frustrated. And I told her, and this is true, I have friends who, and I kid you not, have to email 20, 25 professors before they'll even get a response. And so this is just to say that I think there are certain things that we're even told. I mean, I remember being in college and being told everyone will reply to your emails, everyone cares about you, and everyone really wants to work with students, which is true. But I think it's also a little bit of a slap in the face the very first time that ever happens, to be like, reality is you just got to sometimes email 25 people. And so I love that you say that, Dr. Johnson.
Absolutely. Absolutely. And let me even take it a step further, Daniel, because I think you hit on an important point. I was told in college that I wouldn't quite cut it as a doctor, right? I should consider other options as a doctor is what I was told in college. And I think it's an important experience that many folks actually share coming from college and looking at medicine as a potential option. And so I actually want to turn it back to the attendees and say, listen, you, by being here, you are actually taking it a step towards taking into your own hands your career and your future by just being here, by just engaging in this conversation. These are opportunities that you're seizing to progress your career. But yeah, it takes effort, it takes energy and sacrifice, as you were saying, Daniel, absolutely.
Yeah, I would so incredibly agree with that, that this is a big step just to take an hour out of your day to listen and engage in something like this. So I completely agree, Dr. Johnson. If it's okay with you, I wanted to take a little bit of a spin and look at your day-to-day as a neurologist as well. You told us why you picked neurology. This is going to be a 3-part question, so bear with me. I'm sorry. I want to know something you love about it, something you don't love about it, and then just on average, what does a day-to-day look like, or a week-to-week look like if day-to-days are different?
This is a tough question. So so let's start with kind of what my typical day looks like, and every day looks very different. And I think most neurologists these days could attest to that. For example, let's look at today. Today I woke up in the morning, I ran a few miles, I went to work, rounded on some patients on the ward, and by 12 o'clock I came in, I did some consulting work, and now I'm here with all the wonderful folks here and the attendees, and each day brings something different, and I think that varies so much between neurologist and neurologist. It depends on what specialty you decide to do. So some folks decide to do general neurology like I did, and you see a whole host of neurological complaints which involve the brain and the nervous system, the spinal cord, and so forth and so on. But then you're also, I think what we're seeing too is an expansion in desire for neurologists to have broadening skills, let's call it, right? So folks to actually take leadership positions. So, you know, to lead, for example, in their communities, lead in their departments, involved in research specifically, and really innovate and progress the field of neurology. So it varies so much, Daniel, between one person and another. It really is, I want to emphasize this, it really is what you make it. And I think that's kind of one of the important things about the field of neurology is that you have the ability to make it what you decide to do. I think when you come from a place where, you know, like for example, where I came from, where you don't have tons of folks in medicine, your view of what a neurologist is or a doctor is so narrow. Until you're actually here, you say, wow, I could do that, or I could do this, or I could do that. And so it really is expansive.
Yeah. Sorry, go ahead, Dr. Johnson.
You're gonna. I have to give you kind of what I don't like about it. You know,
that's what I was waiting for.
and I think that's a very fair question. So, you know, we tend to write maybe more thorough notes. So, you know, when it comes to documentation, it's important, but it can get time consuming for some. And so that piece right there, it could be somewhat difficult for some folks. But not every specialty in neurology is like that. Some don't have to spend as much time kind of, for example, documenting notes and such. My favorite part by far and away is talking to people. Talking to people by far and away is the most important thing, I think, in neurology. And so if you actually enjoy interaction with people, this is the profession for you. This is the medical career for you.
That's awesome. And Dr. Johnson, you reminded me, and if it's okay with you, I want to quickly mention how I got interested, at least in the brain, and we can save the heart for later. But to start with medicine, I almost echo the idea of a noble profession. I think so. My parents, a little background, were Copts in Egypt and migrated to America in a time in which they were being persecuted. And it was my mother's dream for herself to be a doctor. In fact, she still tells me to this day how much she loved drawing pictures of just anatomy, the human heart, the human brain, anything. And so I think I grew up with that slightly fantasized or romanticized, as a fantasy of mine. And I, about age 15, had open heart surgery. I was born with a congenital defect in my heart. And it was a surprise. And it was the very first, I think, real taste of medicine, so to speak. And that was a point in which I was like, wow, the intimacy that I talked about earlier, the relationships that I built with as a 14 or 15-year-old with my surgeon and clinical team. And it's funny because my brother actually is applying to medical school right now, and his personal statement is about this. So it's like a immersion into this in this time of my life. And then I was really interested in actually psychology for a long time. I was really interested in why do people act the way they do, choose decisions the way they make them. How does behavior mess up, so to speak? Like, why do we see individuals with such varying behaviors? And so I majored in neuroscience in college, as Dr. Strowd mentioned. Thank you, Dr. Strowd. And that was what really hit the nail on the door for me, so to speak, in the sense of like, wow, we know. So one quick comparison I'll make for the heart and the brain is, and this was a roommate actually who told me this, he just graduated. He said, the heart, we've been studying our minds off for 50 years. We know so much about it. We can heal so much in it. And that's awesome because it makes for amazing patient recoveries. The brain, we know zero about, nothing, nada. Like, it is a black box that every single day there's a new question, a million new questions, and maybe a single new answer. And so that very much fascinates me.
Absolutely. I will say though you could say, relatively speaking, we know zero about it. I will say, specifically over the past 30 years, our knowledge of how the brain works and the spinal cord works, and I can't, it's really even challenging to keep up, to be honest with you. It's so expansive, but it really does stimulate the curiosity. So absolutely, Dan, you're right on it.
Yeah, and the reason I remember that even was because what you mentioned earlier of like, there's so many opportunities for leadership and research and being on this frontier, so to speak, this frontier of exploring in my opinion, most fascinating part of the body and the body that we don't yet know about enough.
Are you sure you're not a neurologist?
Not yet. You're convincing
yet, right?
me. You're working. You've been working on me. Dr. Strowd, I believe that you have, okay, Destiny, it sounds like you have a question. I believe Genevieve will allow you. Oh, there you go. Thank you, Genevieve.
Can you guys hear me?
Yes, Destiny, we could hear you. Hi.
Hello. I just wanted to say thank you guys for having this. It's just a lot, especially me coming from like an HBCU, of course, and just getting the feel and different perspectives and different advice from other people. So my main question is, what would you recommend like for anyone that would be more competitive, like when applying for medical school? Like what, I guess, separates you from the rest or makes you more diverse?
I think we actually could have first of all, Destiny, thank you. I think that's a wonderful question. And I think actually we could have a few folks kind of weigh in on this. But Daniel, I'll actually let you speak first. So you're in medical school. you're actually transitioning now from your first to your second year. You know, what do you feel made you competitive? What did you make a concerted effort to do? And what is your perspective on this?
I not only could a lot of people here speak on that, I think we could have a full day of questions and answers specifically about this question. But Destiny, thank you for asking it. And it was my first question too, because at the end of the day, that was the goal, to get into medical school. So how could I get there? And in retrospect, I think, and honestly, not only in retrospect, but even in the action of applying, something I try to emphasize was, hey, I'm really passionate about medicine and helping people. But in my mind, I was like, everyone applying can say that to themselves, or else they wouldn't be applying. And so in my mind, I was like, well, what else do I feel that I bring to the table almost outside of medicine, but that can be applied to medicine, that maybe others didn't have the opportunity to have those experiences as much. And so I heavily emphasized, and they were important to me, my political science background and my improv background, two things Dr. Strowd also mentioned. And I talked about how I thought those were critical. Those were critical skills in a physician leader, and skills that others who don't have experiences in those two worlds may also possess, but that those two worlds very explicitly gave me the opportunity to practice those skills.
Yeah, Daniel, I think we 100% agree. And so I could speak from maybe my perspective as far as kind of, you know, what I did at my time, but what I see as an important need. So what's the important need that we have within medicine in general, but also specifically within neurology? We need folks with diverse set of perspectives and skills that maybe are outside the textbook. Everyone, I believe, that comes into medical school is quite intelligent. Everyone that comes into medical school is well accomplished when it comes to academics, or has high aspirations when it comes to academics, and have or demonstrated at some point high aptitude for academic achievement. What I find separates folks, though, is the investment that folks have made into their community or themselves to make themselves better people, better humans, and be able to therefore pass that on to whatever organization, medical school, or institution that they go into. I think, you know, looking back, if I had seen myself in college and I'd said, what do I need to focus on? I would have told myself to focus on being a better communicator. Read a little bit more about leadership, invest a little bit more and volunteer a little bit more into the community, and not be afraid to advertise that and to build those skills and connections. And so I agree with you, Daniel. Having a more well-rounded, well-balanced skill set, I think, also separates you as well. I know Dr. Strowd has some information on this as well.
Yeah, I mean, I'll echo the same things in slightly different words. I agree with both of you. I mean, it's find your passion, pursue your passion, and preach your passion. I think sometimes you get in that sense where, oh, I gotta suppress my passion and go do some more chemistry, or go do some more physics, or go do some more, and you're gonna do plenty of that stuff. I think what you've heard, and this is what I would encourage you to do, and I sit on our admissions committee, and what we're looking for is people who know what they're passionate about, they know who they are, and they've pursued it. And then, Daniel, I like how you related that back to medicine. That's what Dr. Johnson just said as well. How is it going to make you a better leader, a better physician, a better? because all those things you're doing will, whether it be improv or whether it would be in the military or whether it be whatever those things, but find those passions and pursue them. I mean, that's what admissions committees are looking for, inside or outside of medicine. I agree with you both completely. Great question, Destiny. That's a great question.
Yes, that's a wonderful question. Agreed.
Thank you, Destiny.
I think, so Brianna, I think, has a question next.
Hello, can you hear me?
Yes.
Yes.
Okay, so I don't really know the differences too much. I wanted to see, like, okay, can you express the differences between psychiatrists and neurologists, and is there times where they work together?
This is a wonderful question. I love this question. Thank you so much, Brianna, for asking this question, because this is something that I even get preachy about sometimes. So I excuse if I get overly passionate about. So in my opinion, neurology and psychology are artificial separations, okay? So that neurology and psychiatry is something that we create. We separate neurology and psychology because it helps us practice medicines in different compartments, but there's a tremendous amount of overlap, and truly these two specialties coexist naturally, right? So, the issues or the challenges that psychiatrists treat are, in a sense, neurological. And we see a lot of neurological disease that is strongly related with psychological comorbidities. In general, when we look at psychological disease and neurological disease, there are some subtle differences, and primarily it's the way that we pursue treatment and how those treatments are pursued. It also has a little bit of historical difference as well. So psychiatrists, for example, primarily evolved through psychotherapy and different forms of psychotherapy that have evolved over time, even to pharmacological or pharmaceutical treatment with medications. Neurology has evolved in a kind of a different pattern, but you see this crossover throughout history as well, where the lines between neurology and psychology has been blurred. I must ask, Brianna, do you have a specific interest in one or the other? And kind of wanted to get a sense of, what are you have an interest in, why that you have those interests in neurology or psychiatry?
I originally began with the psychiatry because I've always wanted to help people, and if I had to prescribe the medicine, I want to be able to do that for them as well. And this past year, however, I've started hearing more about neurology, and I'm like, okay, well, I'm trying to see which one I really want to do now.
Yeah,
but I'm still leaning more towards psychiatry, I think.
I think that confusion is warranted because there's so much overlap between the two. In general, taking a step back, what are the practical differences between neurology and psychiatry? And my psychology colleagues may agree or disagree to some extent, but in neurology, we have a little bit more objective tests in which we could measure some of the things that we're diagnosing and or treating. In psychiatry, I would say we have less validated tools or less reliably validated tools to measure, though we do have some tools to reliably validate and measure to measure kind of the dysfunction or diagnoses. That being said, there's an incredible amount of overlap, and surely enough, we work very closely with psychiatry and vice versa. I'll give you my example. I work in epilepsy, and we have folks, for example, who may have seizure-like events, and so they may present with us with seizure-like events, and our job is to find out what's the nature of their seizure-like events. Sometimes we find that their seizure-like events are due to electrical problems. We call that epileptic seizures. And at other times, it may be to psychological disturbances or mood disturbances, call that psychogenic non-epileptic events. But the bottom line is both of these things cause dysfunction in their quality of life. And so, yes, we work very closely with the psychiatrist as far as working with patients, regardless of which disease it is, so that we can improve their quality of life. So psychiatry and neurology are not, from a mechanistic standpoint, 100% mutually exclusive. They may actually coincide and be one and the same. We separate it artificially to allow us to diagnose and treat in a more comprehensive, systematic method? Thank you for the question. This is a fantastic question, and I'm glad that you've started to think about this a little bit and try to put this together as far as what you may be interested in. You know, my advice would be certainly to engage yourself with neurology and psychiatry and get some exposure to it. You may find a preference when it comes to the actual practical application, that you may have an affinity for one practice over the other, or you might want to do a combination of both. And listen, we need innovators in our field. So, you know, if there's a way of combining them or putting them together in a way that benefits patients, welcome to the field, right?
I'm going to say ditto to everything Dr. Johnson did. Thank you for your question. So, and I'll to add on to one more thing, a little bit of a tangent from what we were talking about. But Dr. Johnson, you mentioned it when you're talking about look at what psychiatrists do and look at what neurologists do. And one piece of advice that I got that I've yet to fully implement, but I'm excited to do so, in the little that I've seen it, I agree with it, is if you are deciding between a lot of similar fields, to look at the patient population, to go work with a physician who's there and see which patients do I like treating the most, which problems, so to speak, do I like thinking about the most. And again, I have yet to implement it fully, but the little I've seen it, it works. And Kelly is the next individual who will be giving us a question. What's your question, Kelly? Hi.
Kelly, are you there? There we go.
Hello. Thank you so much. I was muted. Thank you so much for doing this. I think this is really important. My question is, how did you specifically decide on your specialty, from going from general to then your specialty?
Yeah, thank you, Kelly, so much for this question. I really appreciate it. Thanks for attending. I really appreciate it. So, you know, just to reiterate, my specialty is in epilepsy and clinical neurophysiology. And I have to stress with all the attendees, especially those who are in college, is it's important to understand that once you enter a field, the possibilities expand quite a bit. And so for the longest time, my goal was to be a neurologist. Since third grade, since Bill Nye the Science Guy, my goal was to be a neurologist. But once I became a neurologist, you know, that's it. Like, what do I do next? And what you know drew my interest specifically is actually goes back to something that Daniel mentioned. You know, I had some mentors that were important. So I think that will be the first thing. A lot of folks kind of choose their specialty or subspecialty based on a mentorship that they connect to, a mentor that they connect to, or a lifestyle that they connect to. But the other thing that drew me to epilepsy and clinical neurophysiology was the patients, and seeing that, you know, there's a subset of patients that really was on the, you know, on the precipice of having discovery and innovation, which I really felt that I could impact and make a positive impact for their quality of life. And at the same time, benefit from stimulating the curiosity of the field of epilepsy and stimulating the curiosity of the different parts of the brain, and how different parts of the brain cause you to do different things. And even the way that a seizure spreads cause different presentations of what someone may do. It's really fascinating. And and again, the brain is something that makes us human. So it's like learning about yourself, learning about what makes us human in the process of treating disease. And so this is what led me to kind of consider epilepsy as a specialty. But, you know, suffice to say for all the attendees, and, you know, Kelly, this may apply to you as well. You know, when you enter a field, when you actually come into the field, you realize, oh, you know, this, you know, you could do interventional neurology, you could do neuro-oncology, or the treatment of neurological cancers or cancers in the nervous system. You could do things like neuromuscular medicine. And so all these little skills and tidbits, you really don't know kind of what you connect to until you expose yourself to it. And so one message to take away is, if you get the opportunities, you actually not only get, but seek out the opportunities to expose yourself to these professions, so you have a sense of what you have an affinity for. So this is an excellent question, Kelly. I really appreciate it.
Thank you, Kelly. Dr. Johnson, we're going to move to a question from Rachel.
Hello, everyone. It's been a great discussion tonight, and I'm so glad that you guys facilitated this. I'm currently in medical school at Meharry, and I just had a question about becoming a competitive applicant for neurology as a specialty. I'm very interested in it, just like you, Dr. Johnson. I've been interested in neurology since I was a child, so just would like to hear from you, your perspective on that.
So I'll speak to this. I think also Dr. Strowd would be really a really good resource in this as well. My experience, me coming into neurology was a little bit different than kind of the general population. Why? I actually matched neurology in the military. And kind of my thought process into matching neurology in the military was there are 3 options in the military as far as where to train. There was Madigan, Walter Reed, and San Antonio, and I need to get into one of those, and I don't like to be competitive, but anyone but myself. And so I said, hey, I'm going to choose this route as a bonus. And so my experience being competitive matching into neurology may not reflect kind of what the general population is. So I could kind of give you kind of what that experience is like in the military, but I really would have to kind of refer to Dr. Strowd to give you more information from the civilian side.
Yeah, Rachel, great question. You know, honestly, I'm gonna flip it back. It's more like, what can the programs do to entice you to get there? And I think that's really, when you talk about the residency application process, matching medical students with their residency program, the programs are looking for a medical student that fits the feel of their program, the family of their program, who they have in their program, just like applicants are looking for a program that fits their personality. And so I think kind of back to that discussion of how to get into med school, you know, I think we want to know, programs want to know who you are and what you like and what you enjoy doing and how you're going to bring that skill set to bear to the program. And you as an applicant want to hear, who is this program and who is their makeup, and do I fit with that group? In terms of the group's kind of personality, the medical personality, the hospital personality, the out-of-hospital personality, you know, that's what you're looking at on the interview day, and that's what programs are looking at as well. There's some ways to put that in your application. You know, that's what you're doing with your personal statement. That's what you're doing with some of your letters. That's what you're doing with, you know, some of the extracurricular and curricular activities that you do. And that's also what you're looking to do on the interview, is really let, you know, that personality kind of shine and show how that will benefit and the program and kind of fit with it. We've been doing that for a long time, well before COVID, well before virtual interviews, and we didn't know what would happen this past year with COVID and with virtual interviewing. And, you know, some things were tough, but that ability to see who an applicant is and what they're going to bring to your program, and I think even for applicants, understanding who is this program and what are they, that stuff shines through. I mean, look at Dr. Johnson. You love this guy, right? You know, you can tell. Look at Daniel. I mean, you know who these people are, you know, even through the limitations of Zoom, and that's able to come through on interviews and those sorts of things. And so that's what you're looking to show up on the interview. That's a great question, though.
Yeah. And Representative Meharry, thank you for coming. Thank you for joining.
Of course. Thank you so much for your insight, Dr. Strowd and Dr. Johnson.
Of course, of course.
Thank you for the question, Rachel. That was helpful to me as well, because I also have those questions. Dr. Johnson, we're going to go to Nelson next.
Oh, great. Wonderful. Hi, Nelson.
Hello, can you get me?
Yes.
Yes.
How are you?
I'm all right. So I just wanted to find out, like, at which level of your undergrad is it mostly advised, or would you advise someone to take their MCATs?
So, Nelson, and Dr. Johnson, Dr. Strowd, please correct me if there's anything wrong that I say, but just from my experience, Nelson, it's not a straightforward answer of like, this is the year to take it. I could tell you when I took it, and when most people who say, I want to not take a gap year, take it. And that is sometime in your junior year. And so if you're really on top of your stuff, which I was not, I'm going to say that, I'll be the first to say that. Some people take it right before they start junior year, which is difficult because you haven't taken physics, you haven't taken, or it matters how your school system works, but you haven't taken some of the classes that might be preparing you for the MCAT. Other people take it during winter break at the end after they have time to study. And I took it right before junior year ended, which I, in retrospect, do not recommend simply because it was tough to take during the year. But the final answer being that you take it so that you can get your score back before the summer of between junior and senior year, because that's when you apply for medical schools. Now, if you don't plan on going straight through, or you want to take a gap year, then you can at that point take it whenever you want, as long as it's enough time that you have a month after it before, let's say, June comes, so that you have your score before you apply. Does that answer? And Dr. Johnson, Dr. Strowd, please correct me if I said anything incorrectly. That's just kind of what I saw with myself and with my friends.
Yeah, I would have to say that I can't offer more information than you offered, because it was a little while since I took the MCAT, to be honest with you.
And I think from my standpoint, this is one of those things that just is important, and you want to do well and you want to perform well. I think, Daniel, you've given good insight on that kind of gap year, non-gap year kind of thoughts. I think I would encourage you to reach out to pre-health advising at where you are and ask them that question, and then ask it to the next pre-health person. And then, that's a good question to kind of ask and get a number of different opinions. And the only thing I'll say is you want to take it when you feel confident that you're going to perform at your best, and yourself. And I think you got to listen to those opinions around you, and you want to seek those out. But you've been studying for a long time. You know how you study, when you're ready to perform. And this is one of those things where you do really want to perform well on this one. And so taking it the time that's right for you is a good idea. When I was going through, nobody took a gap year, and to take a gap year was a little bit strange. But best friend of mine did, and because he just wasn't ready, it just wasn't in the right spot. And that was the best decision for him. I think nowadays everyone's taking gap years, but for many people, that's not the right thing. And so, if that's not the right thing for you, then you don't have to be pushed into it. So I think seek out that pre-health advising, input, but also know yourself. And this is one of those things where you do want to take it when you're ready.
And a word about gap years, now that we brought it up, I think actually this is very interesting. Actually, I'm not sure if it's your experience, Dr. Strowd and Daniel, but it's become somewhat of a trend, I think. And I think it's actually an important trend where folks are taking gap years with a goal, with a purpose. And what I think schools are recognizing and programs are recognizing is that these are broadening experiences that make applicants better, whether it be for research or community service, or actually just holding a different skill set, learning a different skill set. And I think the quality of applicant that comes through for folks who really, like I said before, invest into themselves or invest into a skill for themselves and build, I think is quite attractive. In fact, I've learned a tremendous amount in my medical school from folks who took gap years. So I think it's really something I think that maybe traditionally was looked upon with kind of a side eye, that now I see as a real benefit, a true benefit, especially because once you start medical school, the ball drops and it doesn't stop dropping.
It does not. And I want to, it's actually one of our frequently asked questions about gap years. I'll return to answer your question in one more way, Nelson, but I want to quickly comment on this because it is a question I think a lot of people ask. Just to give you a little bit of reference, I think 80+% of students my year from graduating college took a gap year. 50+% of current medical students in my class took a gap year. So not only is it a trend, it's almost the norm. And I think it will be the norm at some point. And I would echo at least that strong point that Dr. Johnson said of it broadening your worldview, your field, and to do something that you're passionate about. That's the biggest thing I'd say, because I think some individuals take a gap year as a break, and it should be, but only as a break. And I want to quickly return one more thing to the MCAT and the timing. Something Dr. Strowd said reminded me of this, is that not only, and this might go without saying, but I think I definitely had to be reminded of this point sometimes. Not only should you be mentally prepared, but definitely emotionally prepared. I had a friend who studied their butt off. They went through a breakup like a week or two before, and they postponed it. And I think that was the right decision for them because they were not in the emotional mindset to take it. And so like Dr. Strowd and Dr. Johnson said, this is just a really, really important test, unfortunately, in my opinion, but it is. And so you just got to knock it out of the park. Nelson, that was a really long way to answer your question. Did we in any way?
Yes, those were really helpful insights. Thank you very much.
Got it.
Destiny, if you could come back, actually, there's a specific question you asked about role models, if you wanted to ask that to the group.
Yes, I was just wanting to ask, who is your biggest role model, or name someone who has heavily impacted your life, like not only like in your career field or just in general, who's impacted your life the most?
Daniel, I'd like to, if you can, answer this question. This would be great. This is a great question, Destiny. This is a very important question.
This is, I agree, a phenomenal question. And I think I have a visceral response to this question, and that's the answer I'll give. And I think I've been asked this question and given multiple answers in the past when I think about it. But my visceral response, and it might sound cheesy, but it's absolutely my mother. And it's because I think it's because of the reason so many of us choose our mother, but I think very particularly, it was seeing what she did when I had to go through heart surgery, which was, to give a little bit of background, I had something called a bicuspid aortic valve, which caused regurgitation. Basically, when my blood pumped up, it fell back down. It didn't reach the ends of my body. And so at the time, the suggestion from like the first 7 surgeries we went to was replace the valve, which basically means they would put a metal valve in my heart, which would necessitate blood thinners for the rest of my life. And if any of you have grandparents or anyone else who's on a blood thinner, it greatly limits your life and what you can do. And I was an athlete, and sports was something that brought me happiness and something really important to me. And my mom, bless her soul, who knew that and knew that that was something that brought me joy, went to world's ends and I kid you not, maybe spoke to 45, 50 surgeons, excuse me, from around the nation. And so we found one, and she did a lot of research on him, who said, and now I'll also say repairs, which basically means fixing the current valve, is the norm. At the time, it was not widely practiced. And he said, I've done many repairs. I think I could do that because I see that that is important for your son and for your family. And so what was to some extent a straightforward answer, and it was an answer that she didn't like and I didn't like, she sacrificed, she basically quit her job for a year. She sacrificed everything that she cared about in order to make sure that something that was important to me was done. And it came out and it worked perfectly. And to this day, I have cardiologists that say, if you told me this valve was done yesterday, I would say this is the best surgery I've seen. To say it's done 7 years ago is out of this world. And so this is a 2-part answer in that my mom and that surgeon, but the character, so to speak, of sacrificing so much for someone else, your patient, for example, even though their answer might not be the traditional answer, is something that was really important to me. And I hope I can do that the day I become a physician.
Daniel, thank you for sharing. I think that's tremendous. I have to say, Destiny, the reason why I appreciate this question so much is because I don't think that any person gets into any position of success without being on the shoulders or deriving motivation or getting the support of not only one, but a few people around you. And I think it's important to constantly look around for those sources of inspiration and reason why we're in the position that we are able to do kind of what our passion is. And I think it's important to reflect upon that and notice how close those individuals are and what they've sacrificed in order for us to be in those positions. So, I am certainly one of those people, just like everybody else here, who are blessed to have folks who are very, very supportive and compassionate. But certainly my role model would be my father. My father, both my mother and father come from very humble beginnings, but my father, African-American man growing up in Knoxville, Tennessee, and lost his father early, growing up in foster homes, defied statistics. And he did it, for really the legacy of what he wanted for himself and what he wanted for his family. And that always served as a source of inspiration to kind of look back upon and say, this is where things could have been, but this is through will, through grace, through hard work, determination, all the features, and maybe even quite a bit of luck, we're able to kind of excel and move forward. We talked about honorable professions. My father was one to talk to me about the medical field as being an honorable profession, but here he was in New York City as one of New York City's finest. And most of what I know of how to be successful does not come from medicine or a textbook. It comes from that work ethic and that approach and how you approach how you become an expert basically in anything that you're encountering. And so I think your question, Destiny, is so important because I think it speaks to how we need to reflect not only on our role models, but what qualities did they teach us? What qualities do they embody that we could use to become successful? And I think any success that I enjoy as a neurologist comes from that. Thank you for the question. That was great.
Thank you.
And Destiny, before you go, I do want to say one more thing that Dr. Johnson reminded me of, in the sense of standing on shoulders before us, whether it's Dr. Johnson's father or my mother, and I kid you not, maybe almost the tons of mentors that we've had on our way here. At least I, for myself, and almost every step to where I've gone would not have been able to get there without a number of people involved. And I think the reason I'm saying this, because Dr. Johnson reminded me, I think it's important to remember that in steps so that when you do, not if, when you do get to where you want to be, that you can also provide that for everyone that you meet and needs that, and needs, especially those that might not get that as easily or might not have access to mentors as easily.
I'm going to actually use this as a plug, Destiny, because you actually put it in my mind. If you ever need a mentor, you're requesting some mentorship help, particularly within the field of neurology, the AAN actually offers this app here called the Neurology Question of the Day app. And as a part of that app, you could select a section where you could ask a mentor a question, an important question that you have. And it could span really from anything from application to applying to neurology programs and what have you. Part of the challenge is not only getting mentors, but knowing how to navigate things within a field that you may not get exposed to. And I'll tell you firsthand, neurology is an incredibly rewarding experience. And so it's a shameless plug, but it's a plug nonetheless. If you could get it, go ahead and download it. Android and iPhone.
Best of both worlds. Apologies, guys. So really quick, there's an anonymous question that I'll ask out loud. And that question is, how did you decide on your specialization? Dr. Johnson, you talked a little bit about this. If you want to elaborate a little more, Dr. Strowd, also if you want to pitch in a little here.
I spoke a little bit about kind of what it is. And the primary one for me is about my subspecialization was kind of the patient population I was interacting with and how I was both able to fulfill kind of my curiosity of neurology, learn about the nervous system, but make this huge impact, I think, on the quality of life of the people that I was seeing. I know, Dr. Strowd, I don't know if you have a perspective kind of on your subspecialty and how you came to choose it.
So I didn't go through full introduction, but I'm a neurologist and neuro-oncologist, right? And so that means I do brain tumor work. The way I'd start to answer this question, and I'm not going to take too long to answer it, but as neurologists come in all different shapes and sizes and all different backgrounds, and then we do a ton of different things. And I think that's one of the things, I mean, that's true in a lot of fields, but it is definitely true in neurology. The nervous system controls everything in the body, everything. From the top of the head all the way down to the bottom of the feet. And so we have some neurologists that want to do all that. And they do general neurology, and they know more about the nervous system than all of us would ever know. And that is fun and fascinating to them. Other folks do want to subspecialize. And some people live in the central nervous system and handle central nervous system disease, like stroke vascular neurologist, or Parkinson's disease movement disorder neurologist, or dementia behavioral neurologist. Or multiple sclerosis by autoimmune and MS neurologist. Others like to live out in the periphery, and they do peripheral nerve disorders and look at neuropathies, or focus on that junction between the nerve and the muscle, the neuromuscular junction, with a condition called myasthenia gravis, or like muscular disorders, myopathies. And so that is just every part of the body that neurologists, we have our hands in. For me, it was brain tumors. I'm fascinated by them. There's a lot of research opportunity. I get to treat the patient and the family, and I really enjoy that. And I work with a real big multidisciplinary team. We work with radiation oncologists and neuroradiologists and tumor surgeons, and I really enjoy that. So the only way you'll know which of those things you like is to get involved. And I had no idea I wanted to do this until, as you've heard from all of our panelists, we kind of got in there and got involved and found those areas.
One of the questions that commonly come up. So, what other specialties would we consider, and why did we choose neurology over that? I'll tell you, my personal experience, I was for the longest time between neurosurgery and neurology. I love to work with my hands, and I'm very procedurally based. I'm a tactile and visual learner. So neurosurgery seemed like the perfect opportunity for me to explore my curiosity of the nervous system. But like Dr. Strowd was mentioning, when you actually do it, you illuminate a few things that you find either works for you or does not work for you. And what did not quite work for me is that, I was in quite literally a 19-hour surgery. And that kind of was life-changing for me. I said, I don't know if I have kind of the attentional span to do that. I can't say I have attention deficit hyperactivity disorder, but I don't know if I had the stamina specifically to be in one surgery for that time. And I also had to ask myself some lifestyle questions, right? The schedule of a surgeon is very long and very busy. Why, for example, internal medicine as opposed to neurology, or psychiatry as opposed to neurology? It really comes down to when you're exposed to the field, and it comes down to exactly why it's important to have exposure into neurology. It's something that you connect with. It's something where you see that it fulfills a passion or a curiosity or an interest that's aside from perhaps or congruent with how much money you make or a lifestyle that you may enjoy. All these things play a role.
And I think that one other thing that comes to my mind to add to that, so, and this relates to one question about, do you see general neurologic disorders or kind of in your subspecialty? I mean, you can make this job what you want. So I in my clinic, I see just brain tumors, but I really like to teach. I love to teach residents and students and college students. And so I attend on our inpatient ward in our inpatient hospital, and that see patients in the hospital, and that's all neurologic disorders. So I didn't want to give that up in my practice and still able to do that. I do a lot of research. About 50% of what I do is research. I get to research and ask questions and answer questions. And some of our other neurologists do a lot of education. So there's just a lot of career pathways that you can pursue, in a lot of different fields, but definitely as a neurologist, and all of those opportunities are open to you. All right, I'm going to ask the last question. Destiny, it was another one of your questions. You had some great questions. But we have just a couple of minutes left, maybe 2 minutes. So Daniel, Dr. Johnson, if you had to say one way that COVID-19 has affected both of you, what would you say? We can't get out of a Zoom call without talking about COVID a little bit, but, how has that affected you, as kind of a neurologist, and what do you think?
Dr. Johnson, go ahead, please.
Yeah, so I will say that COVID-19 and the pandemic has raised emphasis on the importance of what it means to be in the moment and to spend time with the folks that you care about and appreciate them and not take them for granted. I think it's very, before COVID, I think our lives were very, very busy. Our lives were go, 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 go. And really the pandemic forced us indoors. It forced us to slow down. It forced us to do some things that were outside of our typical comfort zone. But through that comes an appreciation for maybe our support systems, our family, and some of the things that we enjoy that we had a chance to reconnect with. And I think that's important, not only as a human person, but also especially for me, I think as a neurologist as well.
Yeah, and before I even answer this, I want to one more time thank Genevieve, Dr. Prasad, and Dr. Strowd for hosting us here. And I'm going to put my contact information in the chat I just did. And I want to echo what Dr. Johnson said, and of course, thanks to him for being with us here and giving us his time, but specifically in reference to the social support. And I think that's what I lost. Specifically talking about medicine, that's what I maybe have grown to appreciate even more so after that year, especially in medical school. Medical school is tough. Wherever you go, it's tough. And so you need to really lean on social support and your friends, your family, your loved ones, and people that are going through the similar experiences you are when you are here. It is not something that you do on your own. It's something that you do with a lot of love and support. And so I think being forced indoors, and thankfully we were actually in person for a lot of it, gave us the opportunity to really be grateful for having that support, even in a time in which a lot of people didn't. But yes, and thank you for you all.
Thank you for attending, everyone. I really appreciate it. Thank you, thank you, thank you. And thank you for Lucy, Genevieve, Dr. Strowd for having us. We really appreciate it.
Thank you both. I mean, what has COVID-19 brought us to? It's brought us to here, and it's great, Dr. Johnson, for you to join us, Daniel, to have you here. And I echo as well for all that have attended. Thank you for being on. We are incredibly invested in your future, particularly your future as a neurologist. But in anywhere that you want to go, you have our emails, and please check out. Please feel free to email us. Check out resources through the AAN. There are a lot of opportunities to do that. And the last thing, please do fill out the survey on this session. We are continuing these guest neurologist sessions. We're really interested in providing opportunities and resources for you to connect. And so we look forward to your feedback. Thanks for attending.
Thank you, everyone. Bye-bye.
Thank you all.